Welcome, everybody. And for those who might be joining us for the first time tonight or haven't joined in a while to one of our meetings live, the way we hold the space usually is for committee members to have their cameras on and unmuted or muted as they choose, and for others to be muted with cameras off until public participation, which we'll have a couple of times throughout the night. But we have very thick agendas generally in our meetings, including today. And so that's why we ask for public participants to wait until public that point in the agenda. But thank you all for coming and joining us and following along. We're at a pretty critical point in our process here. Tonight, for the most part, we're going to be spending the time sharing and discussing some of the early themes that we're finding in our analysis. October was really a lot of building the ship. November was a lot of gathering, listening data and sifting through town data. And now we're starting to bring it all together, land it into our final report, which will include findings and recommendations, and which is due to the town on December 31st. So we're really getting there. Thank you to our interpreters, Janet and Christine, who have been with us pretty much along the way and being here tonight, and to our committee. Hopefully y'all are fresh-faced and ready to have some vital discussion tonight. Yeah, and we'll start with our intros. Since I'm already on a roll talking, I will start us off. So I'm Emily Megas Russell. I use she, her pronouns. I am person with white skin. I have a braid in my hair and earbuds in, a gray sweater, and I have a blue curtain and white background. And I check.
I'll go Shay Witzberger. They, them, or she, her pronouns. I have white skin and a black blazer and a beautiful double chin, and I am in a fairly plain off-white space. Check.
I am Lana Dever. I have brown skin, short curly hair, newly short curly hair, a tan sweater, and a sort of wooden background, I guess. Check.
I'm Laura Stanis. I use she, her pronouns. I have white skin. I have my nose pierced. I have some headphones and like a blue shirt and scarf. And there's some doors behind me.
Hi, I'm Annalise Griffin. I use she, her pronouns. I have on big headphones. I have white skin and a white background, and I have like a big turtleneck sweater situation that's kind of like coming from my face a little bit. It's like creeping up there. Yeah, check.
Bob Ozer, he or him, a grayer beard, less hair, and flannel shirt. Check.
Hi, my name's Maya Schulman-Ment. I have harsh lighting going on, white skin, gray walls behind me. Check.
Thanks, everybody. Do we have anyone appearing by phone that wants to check in? We may or may not.
It doesn't appear that we do.
Okay.
Can someone send the link for this meeting to Kelsey?
Yeah, I just did.
Oh, perfect. Thank you.
Yeah.
So did I.
Oh,
okay.
It looks like probably Emily's computer just died, is my guess. So she'll be back on in a moment. And I sent the link to Kelsey and others as well. Again, if anybody needs it. Emily is our somatic grounding practice champion. But I will say that much like our public listening sessions, I anticipate that tonight's content is going to be slightly more intense than it otherwise sometimes is. Of course, some of our what we've listened to is very positive, but also quite a lot of what we've listened to is and learned through tracers and other types of research is about people's traumatic experiences. And before we do any sort of visualization type grounding, I want to encourage folks to think about strategies for taking care of yourself when stuff that could be really triggering comes up. And for me, that means you could, dip out for a moment if you need to take space. You could turn your screen off. You could, these are not prescriptions. These are just my own strategies for myself. You could phone a friend afterward or make a plan for yourself afterward. But I have found in seeping in this data over the last many days that there are many times when it's been pretty emotionally heavy for me. And I'm also, have a lot of preparation to do that kind of work professionally or whatever else. So just think about that wherever you are before we get started, that we are going to be talking about the kinds of harms that people experience in life, right? And solutions to those harms, not exclusively, but it's been heavy. So take care. Emily, you want to ground us out? Help us ground ourselves?
Yeah, sorry, I just got kicked off, but here I'm back. And yeah, I think I came in the middle of you sharing some warning and support for folks. And I echo that. It has been a very, very heavy day for me. And also know that I'm not a person who is severely impacted by these things. And still, it has been extremely, extremely heavy. So yes, so please be prepared to care for yourself as much as you can. And I am available outside of this meeting for anybody who needs to connect individually. And I will share, we'll share at some point in the chat the email address that you can reach us at. And I'm happy to have a one-on-one phone conversation with anyone who might need support after a meeting. Okay. So let's take a moment to ground. Again, for folks, welcome Kelsey. For folks who, would you like to introduce yourself before we ground?
I'm Kelsey, she, her pronouns, super busy day. Sorry to be joining late, but I'm here.
Hi.
Welcome. Yeah, Kaz.
I also joined late. Hey, this is Kaz. He, him, or they, them pronouns. And yeah, we have a new puppy, and that's just completely thrown off everything. And so sorry about being late.
No problem. Congrats on the new puppy.
Yeah, thanks.
And I want to read in the chat, Tara says, yes, and much gratitude to all those who shared their stories in these efforts to improve the safety systems in our town. Absolutely. I think that the sharing of stories has been challenging and required a lot of courage and a lot of trust in us as a committee and as facilitators. And I also am filled with great gratitude. And thank you for saying that now, Tara, because it inspired a grounding practice that I really like to use. So I'm gonna use your comment as an inspiration for the grounding practice we'll use. So for those joining us newly today, it's helpful to know that we do start our meetings off with a grounding practice. This was a request made in the development of this RFP and proposal process from some folks to ground this work in the body and in somatics so that we can take care of ourselves and show up for not just the content we're learning about, but also the experiences that we're hearing and often feeling and digesting. So you can keep your camera on or turn it off if you would like. And anyone is welcome to join along. Of course, you don't have to. Nobody will know one way or the other, so make the choice that's right for you. And you can keep your eyes open or closed for this practice, whatever feels more accessible to you. And if you'd like, you can bring one hand to the center of the heart, center of the chest, and maybe you can feel your heart beating. Maybe not. Either way, you can know that it's in there beating. There's a lot we don't know about this time in our lives right now, but the fact that your heart is beating is something you do know. And in this space together, even over Zoom, we have the potential to settle and connect with other bodies, other hearts, other beating hearts in this work together. So take a few deep breaths if you can. If you can't, that's fine too. And I relate to, two of the things I relate to as the work of the heart are grief and gratitude. And I'll offer, if you would like, on the inhale, to draw in and connect with your grief. And on the exhale, to let go and connect with your gratitude. So with each breath, drawing into the heart and connecting with grief. And on each exhale, releasing into gratitude. Gratitude for your beating heart. Inhale, connecting with your grief. And it doesn't have to be about anything in particular. It might not even be yours. Just connecting with grief. And on the exhale, releasing into gratitude. If you'd like, you can imagine somebody that you like has their hand in the back of your heart, on your back. There's so many that we love that we can't touch right now or can't touch us, and so it can be really helpful to imagine touch from people that you like. So just one more time, inhaling, feeling into grief, and exhaling to feel into gratitude. And we can release the practice and rejoin the group as you're ready. Thank you all. And next we'll review our agreements. So I'm going to pin Janet, the interpreter, to the screen and share my screen so that everybody can see the committee's agreements. And these are agreements that we have been following and read at the beginning of every meeting, but also commit to and connect with as needed throughout the meeting and throughout the process. So would any committee members like to read this first chunk of agreements?
Sure, I can. In the process of doing work within the Community Safety Review Committee, we will aim to be curious, acknowledge that we come from different places and different life experiences, center anti-racism as foundational in this process, Center anti-oppression, including work to avoid and end racism, sexism, transphobia, and homophobia, ableism, saneism, and all forms of oppression. Sanist oppression can look like pathologizing language, outing people's psychiatric labels, or engaging with people discriminatorily due to their psychiatric labeling or disability. Be kind whenever possible and use respectful language always. Use both and thinking instead of either or thinking whenever possible.
Thank you, Maya. Would anyone like to read the next batch?
I can read the next part. Use whoa, ouch, oops to pause, acknowledge hurt, and take responsibility. Acknowledge or apologize when we hurt each other, even if we didn't intend harm. Hold space for probable good intentions while acknowledging that intention and impact both do matter. Welcome feedback and accountability from one another enthusiastically and give it generously. Acknowledge the contradictions.
Thank you, Laura. And who would like to read the last batch?
I can read it. Oh, sorry. Who was that? Was that Maya? You can if you'd like.
It was me. I can do it if you want.
Oh, yeah, please go ahead.
Hold a larger vision of big intergenerational world-changing work and honor realistically the short time frame and limited scope of this one effort inside that long arc. Be generous and reverent of people's lived experiences, especially stigmatized experiences like incarceration, arrest, poverty, homelessness, abuse, and addiction. Check our biases individually and together. Work to attune to safety, value the quality of our human experiences together, and aim to make things safer while acknowledging that safety looks different for each person and is never guaranteed. Make change in our community through both the process and the production of outcomes. Hold responsibility of confidentiality with reverence and respect. Informed consent in how information shared is used.
Thank you, Annalise. Okay. Anyone have anything they would like to say about the agreements? Or any needs?
These are also agreements that we're hoping that the community can hold while we're in space together. So if we say something harmful, you can say ouch to us, and we can say oops to you, or you can whoa us if you don't understand. And also that means that we're hoping that our dialogues can be intentionally avoiding oppression and or working to end oppression while we're talking about stuff in the space. And of course you're like allowed to share whatever as public comment, but that's the way that we've constructed the space to attempt to be safer with one another. And those things have come up in the past, that things have gotten hard, and it's helped us, I think, to maneuver them. So thank you for doing that with us.
Laura, how do you feel about taking notes today?
I am feeling great about taking notes today.
Thank you so much.
Lucky us.
So the first item, well, we've already had a few agenda items, but the next item on our agenda is just to check in from our discussion last week, following up with some of all the questions that y'all had. We had a discussion last week where we reviewed the town budget and specifically the police budget, the proposed fiscal year 2022 budget. I documented all your questions, sent them off to Peter Elwell, and of course, in true Peter Elwell style, he was extremely prompt, thorough, and clear in his responses. So thank you, Peter. I think Peter might be in the meeting. Yes, and might be available possibly if we have clarifying questions on any of these. But I will go ahead and share Peter's responses to the questions, okay, that we had last meeting, and then we can have brief discussion about that if we need to. Does that feel okay for folks, for me just to read the question and the answer? Okay.
These are
So-
questions that came up last week in our budget review. Awesome.
Yeah. These were the questions that everybody, the great questions that folks had from the committee in our budget review last week that we weren't able to answer. But now we are. So the first question was, what, if any, role does the town and Brattleboro Police Department play in the school resource officer position in Brattleboro schools? Is any town funding allocated to this? Neither BPD nor the rest of town government plays any role in this. It is staffed by the Windham County Sheriff's Department and is overseen by WSESD, the Windham Southeast School District. No town funding is allocated to this. Okay. Does the BPD receive any funding from anywhere else other than the town? We have regular grant funding in relatively small amounts, including Governor's Highway Safety Program grants for traffic enforcement and justice assistance grants based on our crime statistics. We also receive occasional specialized grants, including COVID recovery this year, a large communications upgrade 7 to 8 years ago, and others. If you need more detailed info about PD-related grants, we can do some research and provide that. And Laura, I just want to say before I go on that I can just cut and paste the answers to these questions into the notes, so you don't need to transcribe. I couldn't send it to y'all before now because I needed to be shared with the public. But now I can put them into the notes. So the third question, and stop me or slow me down if something needs clarifying, please. Where is traffic stop revenue reflected in the budget, and where is it allocated? So Peter gave a town ordinance to refer to, 1555001110.00. Those revenues are allocated to the general fund and are not earmarked for BPD. Okay. There is an 11.5% increase in the budget from fiscal year 2020 to fiscal year 2021. It seems to be reflected in staffing. It looks like the fiscal year 2020 numbers are actuals and the fiscal year 2021 are still budget numbers. The current fiscal year, it's not completed, so we don't have actuals yet. Does this budget increase reflect understaffing for fiscal year 2022, therefore coming in under budget that year? Yes, the town budgets for the full complement of officers, 26 in staff salaries, as the chief's salary is a separate line item. But the actual is perennially under that. Related, overtime is perennially over budget for the same reason. Our under expenditure of salaries and over expenditure of overtime usually nets to an overall savings, and that savings accrues to the general fund balance and is not earmarked for the police department. Okay. Number 5. It appears that the training line item of the Brattleboro police budget is projected to increase 48% from fiscal year 2021 to fiscal year 2022. Can you share the rationale behind that? BPD intends to invest significantly in DEI, cultural humility, and related trainings, as well as in continued development of de-escalation skills. Okay, number 6. The current policy of 3 officers per shift minimum. Is this part of the union contract, a policy, or both or neither? This is not a contractual obligation. It is based on call volume, call type, workload distribution, and safety. Individual BPD officers have some of the highest call volume workloads in the state. In some cases, several multiples over officers in other departments, including Vermont State Police. During times of extreme officer shortage, we have experimented with going down to 2 officers between the hours of 3 to 6 a.m. with poor results. As this matter is more nuanced than some of your other answers in this email, feel free to follow up with Chief Fitzgerald or Captain Kerrigan if you want to explore this further. And the last question, I think. Yeah. At RTM in September, there was a non-binding article at the end that passed that recommended to the select board that the human services budget be increased from 1% to 2% of the general fund budget. What happened to this? What did the select board decide? It is not reflected in the fiscal year 2022 projected budget. And I know that the Human Services Committee just submitted their funding recommendations, but I cannot seem to access it on the committee site. So I'm not sure if it is reflected in there. The response is, because RTM's action was non-binding, I showed Human Services as being level funded in staff's fiscal year 2022 budget. That is our standard practice since RTM has its own advisory committee for this funding. It is common for the committee to recommend a number different than the prior year, and select boards usually modify the proposed budget accordingly before sending it to RTM. This year, we just received the Human Services Review Committee's recommendation, and it is for $275,400. This is a substantial increase over fiscal year 2021, which was $210,340. But it is not a full 2%, which would be in the $370,000 to $390,000 range, depending on which one uses for the baseline number and calculation. The Select Board has not yet discussed Human Services funding for fiscal year 2022 because we are awaiting the committee's recommendation. This will be on the Select Board's agenda next Tuesday, tomorrow. I expect they will have a preliminary discussion, then follow up with additional discussion and action on this topic in January after receiving the CSRT report. Any further questions or discussion on those points for the budget?
None except that I think it will be we'll talk more, of course, but based on what I'm seeing and learning, I can imagine applications for our report being broad. And one is for the Select Board, and they're thinking about funding. One might be that the Human Service Committee look at what we've encountered, which has a lot to say about the way that human services currently happen and the way that and just like we've been talking, it's like drawing slowly, we're drawing a map of the gaps, parts of the system that are not causing harm, the parts that are, right? So I think it'll be really helpful for so many people to see what we're gonna produce, including those human service providers themselves. Thank you for that great info, Emily.
Good point.
It also what you shared also illuminates something else that has been coming up, which we'll talk about more in the next agenda items, which is that there are certain changes that are, or recommendations from the community that the town has absolutely no power over, or certain struggles or problems that are occurring in Brattleboro that are not a Select Board responsibility precisely, you know? And I would say that that those things happen at the state level, or like when county sheriff is the agency responsible for the school resource officer. There's so many instances like that. So I think that we're going to need to connect together as a committee, and Emily and I are going to need to be precise in our report and be honest about what we're hearing, and also be reasonable about what the scope of change is. You know, that this can be a resource for any of those bodies. This could be sent to the state, right? If there's state oversight of something, that it'd be useful to show them. But that this, you know, we were contracted to do this, and we proposed to do this to the Select Board, and they have a responsibility for many things and only some things. So we'll just have to think about that as we move forward. And I see.
Really quickly, did you just say, I don't think we talked about the exact percentage increase last week. We just noticed it was jumping really up. Did you say that training was going up 58 or 48%? And
48. It's proposed to increase 48%.
Yeah, and it was de-escalation and cultural humility.
And DEI.
DEI.
Yeah.
Diversity, equity, and inclusion.
Right. Sorry.
Yeah, and I appreciate you bringing that up because, you know, thinking about DCF and all these other pieces that the Select Board doesn't really have. Yeah, thanks.
And I want to just read Aine Thompson's comment in the chat, which is Aine's on the Human Services Committee, and Aine is sharing that the Human Services Review Committee We recommended that all applicant requests be fully funded. That amount, about 1.3% of the budget, represents the full asks of the nonprofits who applied. So, so although there was a non-binding amendment in the RTM meeting last year, it sounds like what the Human Services Review Committee is recommend that everybody who asked for funding get the funding that they requested. And if I said that wrong, Aim, please feel free to jump in. But thank you for that information. That's really helpful.
I just wanted to quickly ask, it was interesting to hear that Brattleboro Police Department officers respond to more calls than other departments in the state. And I was wondering if we could add more comparisons like that into our report, how are they paid relative to other departments? How are they, what hours are they doing relative to other departments? Just a few different comparisons like that.
You don't have anything to do this.
I'd be happy to help with that.
No, I'm just kidding. It's a good question, Maya. That's really good.
Okay.
Yeah. Yeah. I think that was the officer to call ratio kind of. Yeah. And I mean, it's not a very large town or a very large department. And so it's going to be any change in that number. 3 is a small number. So a change would be sensitive in terms of how much capacity, right? It reduces the capacity 1/3 on that on any shift, right? So that's something we have to take into consideration. And, as we consider potential areas for recommendations, it is clear in the response that, our question was really about are there contractual obligations that we need to be attuned to as we consider that as a part of our recommendations? And it sounds like there's not.
Yeah, one thing I want to point out is that the money that's being allocated towards sensitivity trainings and those kinds of things, I mean, that's a place where that money can go to somewhere a little bit more concrete, because we've already seen across the country that sensitivity trainings like that, they don't do a thing. That's just window dressing. So there's just one area that I would like to make as a sticking point.
Mm-hmm.
And we'll
talk more about that. Yeah, go ahead, Kaz.
Oh, no, I was just, as someone who's been involved with designing police trainings and see from start to finish how those pan out. I'm not feeling good about that being an effective use of town money. Thanks.
Yeah, those are really important points, and I think something we'll talk more about as we talk about some of the other themes regarding training that came up. So let's talk more about that, please, because I think that's really important. Any other comments or questions or thought? Yeah, Bob?
So I think we've had some discussion about welfare checks.
Bob, would you be willing to turn your camera off before you share? I'm sorry to interrupt you.
With respect to police calls. And I'm wondering if there's an easy way. Okay. Is that a bit better?
No.
So we had some discussion about welfare checks, and I'm wondering if there's a way to look at welfare checks spatially in terms of shifts. If they are a certain type of day, or have you already done that?
So I'm hearing, I just want to double check because your audio is garbled, but I'm hearing you ask about welfare checks and whether or not there's a way to find out if, get a report on welfare checks spatially throughout the day, like what time of day there might be more or less. Is that accurate? We have not looked at that. I can certainly see if it's possible for us to get a report. I do think it's interesting that in Peter's responses, he said that they experimented with going down to 2 officers, 3 to 6 a.m. with poor results. So as he said in his response, I think it probably makes sense to try to have a conversation with the chief and the captain about that experiment and what happened, and also, you know, what is possible with that piece.
And also, I just want to say that once we get into the listening and once we produce the final polished, scrubbed, honest data about people's experience of welfare checks, that actually might help us understand the relevance of that information. So I think all information is good to get. I'm not suggesting that you don't get it, but you know, there may be information that we produce about how useful the use of the police for welfare checks is, or who, you know what I mean? Like how people are experiencing welfare checks is part of what we're hearing from folks. So I think we should continue to just get all the data and keep loading tasks on Emily. But I also think that that those things will become more contextualized when that's what's happening for us, for Emily and I. All of these pieces are becoming contextualized, and the information that she's getting from the policies and procedures and the stats that are collected are coming together with the individual, listening to individuals and listening to people who work in the systems. And the context actually is its own information, right? And so we're gonna continue to explore that tonight to a level, because all this is emerging and we're not totally done with our analysis yet. And then we're gonna next week talk about preliminary recommendations, and we're gonna continue to look at the data as it becomes more precise and more clear. So keep requesting info from Emily for sure, but also know that that's not the only thing that matters. The context seems to matter incredibly.
In a similar vein to the welfare check question, I've been thinking a lot about how the sort of like who is on traffic patrol, like whose job that day is to pull people over, because that feels to me like a big friction point that there could be some solutions for, especially if you take into consideration the idea of like vision zero and like the idea that traffic design is a design problem, not, or like traffic law breaking is a design problem and not like so much a legal human problem.
Yeah. Great question, Annalise. Let's bring that back up. Hopefully, when we talk about some of the themes and systems review part of the agenda tonight, we'll talk about the traffic study, the traffic stop study. And I think we need to start thinking about possible alternatives to the current system. I want to give voice to HB's comment in the comment box, which is given Kaz and Lana's comments, if they're going to move forward with training, regardless, making recommendations about who the trainers are, directly affected folks, BIPOC, transformative justice, abolition oriented, etc., could be great. Thank you for that comment, HB. I think a good in terms of
to add on to what HB said, it would be nice as well if it wasn't a one-time thing, to be accountable to those groups where they do the training, and to have to check in with those groups and say, how did we do? Not just a one-time and done thing. And if nothing else, at least the money goes back into the community and goes into BIPOC and people who are affected in our own community, instead of calling in, I don't know.
And I just, again, the listening data, we're coming up to it, folks. We can't wait to get to it. Sorry, my thing just fell over. But I think police increased accountability is one of the themes that we will be talking about in the next agenda item. And one of those pieces of accountability in my mind, and that I'm hearing from professionals that work in the system and from people, is that a 48% increase in a training budget could actually be harmful unless there's accountability around where that training is coming from to the people who are naming that system is harmful. So that may look like us making recommendations about who that is. That may look like us making recommendations about who makes the recommendations about who that is, right? That may look like other accountability structures that will help support that process to be sustainable, because we're a one-time committee. We are not going to be around forever, despite what Gary continues to tell us would be great. This is not a permanent structure, organizing structure that we're in right now. And so it could be that part of our recommendations also include structures for support and accountability over time that might help decide what the levels of training are that are supportive, what the types of training are that are supportive, what does not need to be trained and needs to be dealt with differently. And we'll get there in just a moment. Kelsey, I see your little blue hands.
Yeah, I'm a little concerned about time because I'm so looking forward to hearing what you have to share with us. But I keep thinking about, we're talking about next week, talking about the, forming preliminary recommendations. When we talk about that, that's going to be the opportunity for a discussion with the committee, but then ultimately it's going to come out in the report, right? Like there isn't going to be a time for us to be coming, sort of deciding upon what the recommendations will be as a committee is what I'm understanding. Can you clarify that for me?
Yeah, I think that the final recommendations are going to be Emily and my responsibility.
That's
but
what I was.
But our hope about the process is that you all can inform that as much as possible. One of the challenges of the process is open meeting law, which means that we can't give you data until we give everyone in the world data. And we can't give anyone in the world data until it's absolutely safe. There are incidents of harm that have happened in our community where if you even just name the identifiers of the one person they've happened to, the parties responsible for that harm might know who that is, and those people don't want to be retaliated against. So we're doing a lot of work this week to make it so that this data is usable, accurate, and able to be shared with everyone, but it's not all the way there yet. So we're going to be sharing today emerging themes. Next week, I hope that we can have some more final data to show you all and talk about preliminary recommendations. And I'm gonna make a recommendation at the end of this meeting that we either have a longer meeting next time or 2 meetings next week. Because I think that it makes sense, even though it's Emily and my responsibility, it makes sense for you all to have a little bit more of the final info before we move into the final recommendation phase. And Emily and I are trying to just hold your advice and listening while it's our final responsibility. So
thank you for clarifying.
Thanks for asking, Kelsey. All right, budget specific questions to close out this agenda item, and then I would really like us to move into the next one. Great. Let's ask more questions about the police to Emily after when she shares in her next sharing. But I'm gonna go first. I'm gonna make time for a little bit of comment after I share. Even though it's all a crunch of time. I hoped to have this a little more polished for you all this week, but I've been super sick and having a family emergency. And so what I'm going to share with you is theme. I'm looking at all of my thousands of spreadsheets right now. So in our proposal, we talked about centering the voices of people who are most impacted by these systems while holding space for everyone. And in our surveys and our interviews, we did that. We made space for people to share any identities that they wanted to share. They didn't have to. And we took everyone's feedback. And also, I'm trying to break out the results, both by total number of people who have said different things and also by approximate identity categories. So the data, so the way that we're doing that is that I have combed through every interview notes and survey responses and have pulled out the things that they're all narrative responses, almost all. There's almost nothing that was like a multiple choice. If there was, it was like positive and negative, or other, and you can tell us, but almost everything was just people's own generated ideas. And so some of the biggest categories of information from the listening from individuals in the community are: what supports your safety and wellness and thriving? What are the biggest threats to the community, to your community, to you? What are your feelings about or experiences with police, DCF, the mental health system? And what are your solutions and visions for a safer community? Those could be specific to those situations, or just like, what do you think is going to help us be well in our town? So we'll start with the positives. some of the strengths that are coming out strong right now. I'm not going to share the exact numbers because they're not totally done yet, and I don't want to be inaccurate. But the biggest theme coming out of what's been supportive to people is this process. Thank you to my fans. This process has been a big theme that people feel like the town is doing good for safety by engaging deeply in this type of effort and study. People named that their own families and friendship networks and cultures of support are the most helpful to them when things are hard. Folks named that access to wealth or financial privilege make things safer for people, and that community groups like The Root, Out in the Open, and other like community gathering spaces that are just spaces for belonging, churches, are really supportive to people. Also tons of other stuff, everything from access to local food to THC to law enforcement to town funding to human services. There's lots of like smaller themes that are emerging, but most people say the things that keep me safest are the natural connections that I have and connection and belonging in my community, and the town taking this stuff seriously, which is interesting. Biggest threats to folks and community. Again, we will have numbers that are clearer about the stuff later, but poverty, homelessness, hunger, addiction and opiates, addiction response systems, systemic racism and white supremacy, and lack of housing, that's somewhat redundant. Yeah, those are some of the biggest threats, and police. Those are some of the biggest threats. When I've preliminarily, I don't have all the data entered yet into this new fancy color-coded system that I've invented recently after I did a whole other organization system. I've transferred it all over to a better one. In the better one, I don't have it all entered yet, but so far, it looks like amongst white people, poverty, police, mental health response systems, and addiction are all things that people named. People who did not list any identifiers named addiction and opiates and poverty as the biggest threats to community. Amongst people of color so far, systemic racism and police have been named as some of the biggest threats. Amongst queer folks, poverty and systemic racism and policing and homelessness are some of the biggest threats. Amongst neurodivergent, mad, mentally ill, psychiatrically labeled, or psychiatrically disabled people, which I've included in one category, police and mental health response are some of the biggest threats. Amongst disabled people that are not psychiatrically labeled specified. So someone could say, I have a disability, and it could be psychiatric disability. But if it's not specified, I've put it in a disability, not psychiatrically specified category. Poverty and addiction and opiates are some of the themes that are coming out. Those might shift slightly in terms of like how much of each, because it's not in there yet. Some of the data that I still have to input into this new system is from our listening sessions that were public. So you all heard some of the other things. But those things, you know, in my first analysis in a different system, those were also fairly consistent as some of the threats. Feelings about or experiences with DCF amongst individuals in our community. Damaging, needs more accountability, required recovery or support outside of DCF to heal trauma, more punishment than care, took away autonomy and control from the person who is experiencing violence, and fear were the biggest themes. That was consistent both from parents who experience child removal, and also from youth who experience DCF intervention, whether as youth or now they're adults, but when they were youth, they experienced DCF intervention in their home. And that is true. And again, the themes might emerge more because it's not totally done, but that's what's emerging. I think that I did not receive a single response in any format from individuals in our community that felt positive about their experience with DCF. With regard to mental health system stuff, emerging themes amongst the total everyone include that we want more access to support, more immediate support, and also that involuntary support caused harm, that voluntary support was necessary for the person's healing later after involuntary support caused harm, that the support that folks can get in town feels more like punishment than support. Again, these aren't categories we generated. This is like what has come up through people's own voice. People feel fear and threat to themselves for many kinds of mental health support. Multiple people have named that they witnessed or experienced torture, the word being originated from the respondents and not us. Torture, the word torture was used many, many times in people's response around their experience of being in the retreat or being in the emergency room, or with particularly witnessing experiences with rescue. And with police responses to mental health crisis. There were many people, including people who did and did not have much substantive contact with that system, who named that they felt like policing was not the most effective tool for mental health crisis. And many people with or without much contact in that system named no policing in mental health crisis response as a preference. Both people who've experienced that and many people who haven't named that they've experienced that, let's say. Queer and trans people and neurodivergent, mad, mentally ill, psychiatrically labeled, and psychiatrically disabled people so far have shared the most about being harmed by that system. Things that seem supportive in that realm often are organic community supports and completely voluntary supports. We can talk more about what that looks like, but it was named just anecdotally in a quote that I will include in the report, both by somebody who's multiple people, I think, who have experienced the system and people who work inside of the system, that it's actually quite challenging to experience totally voluntary mental health support if you're reaching out for support. And I think Emily's systems review will highlight a few cases in which somebody goes in for voluntary support, realizes that the type of support that's offered is maybe not what they wanted, attempts to leave. That voluntary support very quickly can escalate to involuntary support, either formally or the systems will utilize the police or security to keep a person in a place and restrain a person and hold a person and force drug a person when they had voluntarily reached out for support, and that support was not what they wanted. And feelings and thoughts about police. Many people who had minimal interaction with police feel like police are doing a really good job in the community. Some people who have significant interaction with police, particularly as callers, felt that the police did a good job of responding to what they did and were really professional and appropriate. Many people named that they experienced fear around police as the primary emotion, and that is across all racial categories and other categories. Discomfort, nervousness, and avoidance, and dis-ease were common feelings. Terror was named more than once. Trauma response. Many people named that they feel that policing is systemically racist, no matter the size of the community, white people and people of color alike. Many people named that they had personally experienced police racism or profiling in Brattleboro, Black people, and there's a category that's non-Black people of color or people of color otherwise not specified, because somebody could say POC and be Black. I don't know what the, in a survey response, I don't know more than that, but many people named being profiled. There is no response yet from any people of color that name no problem with the police and total satisfaction with policing, as it's happening right now. Every respondent of color has named some challenge with racism and policing locally and globally. Many people felt, and again, people inside of and outside of contact in the system, that we should reduce the reliance on the police for mental health and substance use. Many people have named that they feel like we could disarm police for certain parts of they're very conditional. That's not like all the time or whatever, but there's, of course, within that, there's, people have written me many, many essays about exactly where the cutoff should be for disarmament, but many people feel like many of the roles of police should either be disarmed or go to someone else, essentially, especially around mental health and substance use. People named some concern for police well-being and trauma and wanting police to be better taken care of as long as police exist. Many people named wanting to fund alternatives. Some of those people additionally want to defund the police and fund alternatives. Some people just specified fund alternatives to policing. Many people named visions, we'll get into the vision section in just a moment, of many kinds of alternatives to certain police tasks. So in solutions and visions, the last category of information, and again, I'm going to share all this explicitly with you all soon and the whole community, and talk a little bit more about the methodology, but around the category of sort of like resources, people's visions and solutions were largely access to housing for all and ending homelessness. This is the front runner. Access to better mental health support and addiction support. People's basic needs being met without struggle. Access to medicine, access to resources for support instead of the police, access to jobs and job training and adequate income, access to community spaces for belonging, access to reentry support, access to mutual aid, access to public spaces for belonging and community were some themes. There were some responses about wanting to see less homelessness and drug use in public life. Around drugs and addiction and substance use, many people named wanting to see less drug use and users in public life. Many people named that they want more swift response to known drug houses. And many, many people named that they would like people to have free, immediate, abundant access to addiction supports, which don't exist right now. The supports do exist, but for example, people are naming barriers, like it's hard to get into a place. By the time the bed's available, the person doesn't want to go anymore, or a person waits around. I mean, we've heard these stories in our public forums too about wanting support and the support not always being there immediately and not always being what a person feels like is supportive. And there was more shared concern also with the voluntary nature versus coercive or authoritarian nature of those supports. People talked about wanting more harm reduction tools in the community, whether that's a safer use site, which many people would support, or more spaces to get safer use supplies. Capacity building for community members to respond to overdose was named as a theme. Around mental health, access to mental health supports that are more immediate, access to mental health support just generally is a huge theme of people of all across the community desire. Remove police from mental health. Capacity building for community members to support and de-escalate situations. Lines to call for help without fear of being locked up for mental health concerns. Truly voluntary support. More humane treatment. An end to torture at the retreat, the hospital. Alternatives to the retreat and the hospital were named many times, pure respite beds and things like that. People named that they want to be free to be themselves, and they want public space to be more welcoming for everyone, regardless of identity or housing status or drug use. People named, there's so much more than this, but these are just the front runners with many, many responses each. That they, some people named that they want, many people named that they want alternatives, more alternatives available for everyday non-criminal matters than the police. There are lots of specific suggestions about how that happens, like somebody walking the beat who's trained in de-escalation as a community volunteer, or social workers, or not social workers who have the capacity to involuntarily confine somebody, etc. Many people want access at a neighborhood or smaller community level to conflict mediation and restorative justice and non-punitive support for hard times. Many people want increased capacity for de-escalation and support in the moment and the post-game of a hard situation than incarceration. Around DCF, people want alternatives to DCF when children are at risk and more accountability to DCF. And generally about town, people have some concerns about the way traffic flows and safety for bikers and cars and wheelchairs and access. And people have experienced a lot of car break-ins, and people have all different feelings about the intensity of that experience or whether or not that constitutes violence, a diversity of opinions. So that's some of the themes that are emerging from the individual data. Again, there may be some more that emerge, or some of them might overtake others in intensity once I finish my analysis. Around listening to people who work in community support and safety systems, I cannot identify anyone by organization in their response, but I think that it's safe to identify things by field. And in it's interesting data. I'm going to find the best version of it to think about. In the mental health system, there are simultaneously some people, including people in leadership in there's many different institutions and organizations that constitute the mental health system in the community, including the emergency room. There are people that are naming that there's bias and injury and injustice happening all the way from like low-level staff to leadership. There's people naming that it's absolutely a problem that system is carceral. People are naming that inpatient psychiatric treatment is functionally prison, that a locked institution where people are forced drugged and restrained and put into seclusion, which is another name for solitary, is absolutely incarceration, and that policing and incarceration are not the best supports for people who are having a hard time. There are some people who are naming that there's pay inequality and lack of training and lack of accountability and like labor issues within the field. And there is both naming that there's bias against certain diagnoses and replication of those biases in people's responses. And people name that a lot of the harm is legislated down, that like statutorily there is a response that's expected by the state for certain things that people have an ethical quandary in enacting as workers in that system. That there's not an ethical way to be inside of some of those systems and not do interventions that people feel are harmful as the doer. Some people named that there is fear of injury to staff from patients, and many people named that there is injury to patients from staff as well. That happens very regularly. There's so much more. There's so much more that I can't wait to share with you all. Around the systems that support people in poverty and people experiencing homelessness. There is big concern about inadequate housing stock and insufficient social support for people to be able to access it. Criminalization of addiction, criminalization of poverty, functional criminalization of poverty, even though it technically isn't criminalized, but when you look at the docket and every single person in the courthouse is also a client of a social service organization that supports those in poverty, there's a functional criminalization of poverty that folks have named. People who work in law enforcement and the criminal legal system name that many different opinions, including that people don't want to seek support from them often, that sometimes the process takes people's autonomy away, especially from survivors of violence, that a lot of people focus on drugs and drug arrest, and not that supporting people in a non-criminal way with those struggles might lead to a reduction in violence and crime later, that people will experience less harm if we treat people more humanely. People in the criminal legal system name that we can't legislate our way out of some of these problems. Named a lot of biases. People who support those who experience violence have named that anti-poor attitudes and misogynistic attitudes and stigma from social services and policing all can contribute to harm of people who experience violence, and that safe housing for everyone and more community capacity building, street medics, de-escalation, and those kind of things might reduce violence in our communities. There's ableism named from people who support those with disabilities. People who support and organize with people of color name racism as a central challenge to most systems of support. There are many schools of thought about substance use support in the field, and lots of critiques in many directions, I can say, amongst workers about what needs to happen. Some folks feel that we need to limit police contact with substance users because they experience struggles with policing. Some people feel like the kinds of collaboration that are happening with police are really supportive in that arena. Lots of people named that most impacted people in leadership roles would be really a helpful cultural shift in our community. All the way from the select board to the organizations that support people, all along the way, that if people who have lived experience with whatever that organization does are given adequate training and support to stay in those leadership roles, that can revolutionize the way that treatment and support and community happen. Lots of people named tools like intentional peer support and harm reduction as trainings that would be really helpful to organizations and communities. There's so much more, but that's a lot of what's emerging. There's, there are some divide in people's perspective. There are some people who did not want to name anything about their identity, who are in the community who a small percentage, I think, of the respondents, but some who would like more policing. And most people who named that they hold any marginalized identity would like at least alternatives to be available to people. Many of those people, some of those people named that they are abolitionists and they want to over time abolish the system and have no policing in our community. Some people name that they want to take specific amounts of money from the police for things like welfare checks and put that in the hands of somebody else who's not going to cause harm in that way. And some people just want an abundance of options for people to call, so that the people who name, which many people have named, I will never seek help again after what I experienced. I cannot, and no one in my community can seek help from existing systems. That those people have something to rely on. So many people, especially people of color, named that the existing systems do not feel supportive, and psych survivors especially too. The existing systems are a threat to me, and I can never seek support from them again. So what else is possible for us to add to make it so that people can have support that feels actually supportive? There's so many more brilliant ideas in what people have shared. There are also lots of quotes that I'm working really hard to take all identifiers out of, that I'm not going to share all of right now because we have so much else to share. But part of my report is going to be this information, which is going to be the total of number of people who said each thing. And then these are all the identifier categories that align with those answers. And that the information is complex in that there's a total number. 20 people said they want fridges on every corner, let's say, full of free food for everyone. And then there might be more than 20 identifiers, because one person might identify as white and queer and disabled, right? And that's 3 different identifiers. So it doesn't actually show like the total number of queers who want fridges on every corner, but it does show that if you look at any of those categories, that, you know, people of color who responded to this survey generally name X kind of support would be supportive or whatever. So all of that is to say that I think that this information is going to be so much more usable once it's polished a little bit, into some charts and graphs that will be part of this report. But I will get you the accurate numerical information as soon as it is ready to be shared with the entire community, which is how open meeting works. And that's why I didn't want to show you what I've got so far, because I would rather share generalizations than inaccurate info, even if it's a little bit inaccurate, because this is forever and this is so public, and it's just not, the whole process would be more fallible if we're sharing things that aren't completely accurate. So those are emerging themes. The quotes are breaking my heart today. I have had a very sad day today and this whole weekend of listening to the beautiful things that people envision for our community, and really acknowledging that I feel hopeful that there are so many people who do not hold marginalized identities and who work in these systems who want change and are naming that change is necessary. People all the way at the top of some of these systems naming that they know that there's harm being added and they want change. And I think that is, I'm naming that hope because I need to hold it, and because there's less divisiveness about this stuff than it seems in some ways on the surface. You know what I mean? That I do feel hopeful that people who work in these institutions believe that there are better ways of supporting people than some of these institutions are currently doing. Not all. There is also a big disconnect regarding the amount of harm that's happening in child protective services, particularly. Big disconnect between the harms that are ubiquitously being reported, including by the children and youth who have gone through those things, who are now adults even, and the people who work inside of the child protective field. But also I feel heartbroken because the quotes that are coming at me, which I'm not going to burden you all with entirely right now, but I do hope that people are bravely engaged with, eventually name that people feel afraid of the supports that are offered in their community, especially marginalized people, and that these systems are not working for everybody, which I knew on some level, but I just feel like it's living in my body in a deeper way now. And yeah, I think that a quote that is helping me through this process right now, to not feel like a voyeur and to feel like I'm doing something useful, is that we belong to what we understand. And I feel like I want to pass along to the committee and to the entire public that so many people are naming that around their own community struggle, the rest of the community doesn't know and isn't acting to prevent the harm that's happening. People just don't know what's happening in the emergency room. The people who are hospitalizing people don't know what's happening in the hospital. This is a theme that's coming up again and again. And if they knew, please act if you know, right? So my hope is that we can put these numbers out there and put all of these quotes that I have taken all of the identifying information out of that give people their own voice in the report, to share their own perspectives about their own experiences, and that we can belong to that together as a whole community, and belong to each other, and belong to change, and belong to responsibility for the harm that's happening in our community with all of our tax dollars and all of our sign-offs, right? So that's what's holding me through this heavy process of distilling the information this week, is a sense of belonging to this information and a responsibility that I'm sharing with all of you. So that's the report out about the listening themes. That's it. Does anyone have any brief comments from the committee before we get into some brief comments from the public, before we get into some less brief comments from Emily?
I have a brief question, but first I just want to say thank you so much, Shay, for giving us all of that and all of the work. I know you extended the sort of deadline for responses, even though you'll take them as they come. Did that produce a good amount more? Can you remind me how many responses we ended up getting?
Yeah, so the response numbers are also very slightly unspecific, because some of the responses were from people who held listening sessions. Most of them identified the number of people in the listening session, and they responded. They put those through to in the online forms that we had available. So somebody might say, I held a listening session with LGBTQ community and 12 people showed up. It doesn't say what each of those 12 people's, each of their perspectives was. So there's a little bit of imprecision in the data around the numbers, but the number of forms submitted on the individual survey, I think, was 138. There was a form submitted for each of our public forums. That was many more people than one. And also, it's less precise data because I wasn't able to, especially if I wasn't at a listening session, go through and say, okay, 3 of the people at this private listening session said this, and here's all their identities. So there's a little bit of imprecision around the group listening session data, but it's also very good information and fairly clear. But there were at least 130 something responses to the survey, some of those which represented many more people than one. Around the organizational survey, let's see, there was something like 50, 60, 59 responses about people who work in community support organizations or community safety organizations. And again, very many of those were anonymous submissions or one-on-one interviews where the information is extremely one-to-one, very clear. This person thinks this thing, and here's where they work, and here's their identity. A few of those were like all of the staff at a certain place or whatever, and the identity data or the amount of people who agreed on each thing are slightly less precise. In most of those cases, Emily or I were there, and we can tell approximately if one person said this thing and everyone else disagreed, we're not going to put that 10 people agree with it. But there are a couple of instances in which we don't have it that precise. So all of that will be qualified in the report, that this is, you know, not the most sharply scientific, numerical, precise thing. But I think it's very clear and compelling information. And I think it would be absolutely sinful if folks didn't use that to discount it, because people are sharing that they have never felt like a town process was welcoming or accessible to this kind of information. They're naming this is the best thing that's ever happened for community safety. They're naming that we absolutely have to do more to support people who are marginalized, and that some of the strategies for getting information that cause a slight amount of imprecision also cause a great amount of access. And I feel proud of it, even though it's slightly fuzzy, because the access was seemingly very strong. And some of the ways that happened were Emily and I reaching out to folks, you all, you know, putting this out to people, the town putting it out in different ways. And some of it was through the process that we designed, hiring a couple of groups of co-facilitators from communities that we weren't part of, particularly people of color, to solicit information in ways that they have designed that fits entirely within our process, but that they felt like would work for their community.
So that just to jump in real quick, so that information is also de-identified to us, to Shay and I, you know, as a layer of trust and safety. And I want to just echo what you're saying, Shay, and I feel very confident as a person who has done a lot of reviews in a whole bunch of different formats, that the benefits that we have gained in having layers of access and layers of trust building in a very short process, that the short timeline limit our ability to build trust, but our networks and our access to networks and our networks already built trust and already built safe containers and already built strategies for engagement and access were really benefited this project more than the risks of not having one-to-one identifiable content. Especially because it is not within the scope of this project to get super individualized. Like, we're not actually qualifying individual information. That was never the scope of the project. So yes, I think the themes, we certainly have enough of a sample size and enough content to be able to remark on themes. Yeah.
And we'll be really clear about that,
right?
The parts that are not precise in the production of the data. So I think it's very transparent and very honest and very accurate. And a lot of people named that the things that we've been doing to build safety, build trust, and also being able to just check in with your own community and have that de-identified and sent back to us added another layer of safety to people who feel like these systems have never cared for them, and they can't, you know, that there's not trust in government systems for every community. So I feel so grateful that people were willing to rehash their heaviest moments, often for the benefit of us all and all of our safety and all of our ability to belong to one another. And I am going to continue to, in my whole life, use this as a learning tool for ways to like reduce trauma of resharing as we move forward, and have already learned some things that I would do differently next time, like pay participants for their information, which is a standard across other research practices. But I am so grateful for everybody to share, and I hope that we can do folks justice by presenting this honest information and people's real voices to those who are making decisions about where resources go, and make some change that reduces the harms that are absolutely being named in this process so far, and honors the strengths that are absolutely being named so far of some of the community systems that are already existing that really support people well. Okay, can I open it up to the public for just a moment? Does anyone in the public have any comment about the community listening side of this preliminary half share. Franz, please.
Hi, everyone. I hope I can put this in a way that doesn't seem excessively confrontational. And I'm going to just say that, I do have a pretty extensive background in research methodology. I have a master's degree in biostatistics and epidemiology and have read a lot of studies and critiqued a lot of studies, as have you. And you've brought so much useful information forward that, I think that is rightly the focus of your comments. But I feel a need to add one thing, which is that because you solicited this information from people, and because there was no sampling procedure that was representative of the community as a whole, the one thing that you really can't do is to say that this gives some kind of cross-sectional picture of the entire community. So that you're certainly entitled to take the comments at face value and use them to guide your thinking about things. But I would just caution that you don't have the type of information that would enable you to say, this is what Brattleboro thinks, or this is what Windham County thinks, or something like that, just because you didn't set it up that way. Maybe I should also throw in, I don't think you had the time or the resources to set it up that way. So, what I'm saying is just be careful in not overstating what you learned from this process.
Yeah, thank you for sharing that. I do think that personally, I think that in some ways, the data point that's the least useful is the total number of people who want X, Y, or Z, with no other information attached, for that very reason, because, if these were questions on the census, we might get slightly different results. However, I think that the information that's very useful is that all of these desires and experiences, not all, but almost all, were qualified with just narrative accounts of people's experiences. And my hope is that we can use the numbers just identify themes of what's coming up when people are sharing their narrative experiences. And there will be plenty of quotes that just name individual experiences of what happened when I called for help, what happened when my neighbor called for a welfare check, what happened when I went to the hospital, what happened when my kid was at school, what happened when, and if even one person is naming that they were tortured when they called for help, I think that's valuable information. As you said, I think that it is really valuable information. So thank you for that commentary. And I think, we might make recommendations for further study also, that, we were on the timeline of this weird year. But I think it's very likely, that people are naming that the town reckoning with the harm in a deeper way is something that would be helpful. More reckoning and more understanding of these systems is going to be helpful. So perhaps that valid, and perhaps that critique is also a impetus for further engagement. And that will come from resources, but that's real.
Can I speak to that for just a second, Shay? I had one thing I wanted to bring up, is that we live in a predominantly white community. And as what we've already learned from the data, that people who aren't affected by policing feel great about the policing. And so
not all
gathering, but some, and that's a larger majority of people, right? I mean, we just have a larger majority of white people. So my point is, the data that we're collecting is from the disproportionately small amount of the community that is experiencing the disproportionately high amount of policing. And so this data pool where you would get everybody's information is less important as the information that we're getting from a smaller portion of the population. And I want to also say that solicited doesn't really, to me, feel appropriate. What feels appropriate to me is that this information was demanded by the community. This opportunity to collect this information was demanded by the community. And that is why we have this. And I think those 2 points are very, very important when we think about this quote unquote data. And I also want to just close with saying that data is often used to harm communities of color, and the ways in which data is collected, the ways in which we interpret and analyze data are deeply flawed and deeply racist and a part of structural systems that oppress us. And so we are moving away from that in this process, and that is more relevant and more valuable to me than some of the studies that I've seen that collect more data and more information. So just want to leave that there.
Yeah, thank you, Lana. Thank you so much for that clarity.
I just want to mean that the listening has also reflected that many people have said, why do you need a study to show that these systems are racist? That's racist.
Whenever there's a Black person being shot, there's someone coming around and saying, I want more data.
And that's what led to this very process. People made demands for change, and the systems that are responsible for change, which is often slow, said we need more information. And many people have named, why do you need more information? I've told you all my information. This has been harmful, you know, and that's people of color, and also people who've been impacted by the psych system and many other kinds of folks. So I feel like we opened up space for anybody who wanted to share, that had access to knowing that sharing was possible, which we tried to make accessible by newspaper articles and all kinds of, you know, ways to increase access. But you know, we wanted to make space. We named in our proposal that we were going to make space for anybody to share who wanted to share to the best of our ability, increasing access as much as we could. And also we were going to be prioritizing listening to the people who are most impacted by these systems. I think we have done that largely, and I feel really proud. And I feel like my confidence in our information comes from the feedback that we're getting from disproportionately impacted communities that says this is good work. This is helpful work. And
people in these communities have long known that these things are happening without ever having proof. You know, the only reason we're here today now is because we finally have cameras that everyone can see. But it's been a very long time that we've had to say, we know this happened, and yet we have no proof. You know, I don't have to have recorded proof of people who are enslaved being abused, because I just know that that is true, because that is inherent in the system of slavery. And when we think about systems of policing, it is inherent. I don't need proof. If you have to carry a gun to do your job, to do a welfare check, or to do a traffic stop, you are inherently violent.
Thank you all. Thank you, Lana, for your voice.
Yes,
and
thank
yes,
you all.
I will assure Franz and the community as well that we will not be making the claim that we are representing a cross-sectional representation of Brattleboro, and also that's not how we designed it. As you said, we designed it very specifically to center the voices of those most impacted, and that's where and to leave it open to anybody who wanted to share. And so it was very open and very available, and our targeted listening sessions were specifically to communities most impacted. Fisher, you'd like to make a public comment?
So brief. Y'all are amazing. This report is fantastic, or the information that you've presented thus far, your methodology, knowing folks that have participated in listening groups, and the safety and comfort has been fantastic. And I think I just want to acknowledge that one of the unfortunate pieces that is potentially coming from this is, as Lana has already said, data doesn't necessarily change things. And so knowing that what is happening is that this data is being presented to folks that may or may not be willing to hear it, respect it, or change things with it. And so just in this moment, I want to just super acknowledge the amazing work and heart and emotion and harm that's gone into this group for producing this. And that in itself is incredible and impactful. And I hope that folks that have already been resistant to change, because that is why this committee has had to form, as has already been spoken, will have a change of heart, a change of action. And also, I really appreciate the pieces around being able to collect information inside organizations. And I think that that is going to be some really powerful and amazing information to put forward, that this is not just an issue within certain communities, that it is systemic, and being able to show that. So again, thanks so much for all your work. It's amazing.
Thank you for sharing. Yeah, and I want to also follow up by naming Kaz's comment in the chat, which is it doesn't have to be a majority experience to be an issue for the whole community. An injury to one is an injury to all of us.
I just wanted to quickly say thank you to Fisher and to Kaz, because I think and feel the same thing. And I'm asking these questions about numbers and things because I just anticipate that they'll come up. But I completely agree. What's important are the stories, and that it is going to be, we are going to have potentially fewer voices come forward and share these experience than maybe what some folks will hope for. But the content of what has been produced is what needs to be heard. So, but I'm just asking those questions, sort of anticipating that conversation. So thank you, everybody.
Yeah, thank you, Kelsey. And I think the numbers are also relevant. They're also important. So thank you for your continued, curiosity about them. I have a ton of information to share, so I'm feeling compelled to move on because but I also need a break personally. So
I'm sorry, Emily.
Oh, that's okay. That's okay. I think the content of the listening is in so many ways the heart of this project. And I just want to thank you, Shay.
Some tools to create the how, and I really want to make space for that.
Yeah, I just want to thank you for how well you've cared for the heart of this process.
You too. You've jumped many more times into the heart than I have into the how. So thank you.
So I need a brief break. I'm wondering if we can take like a 3-minute break. And I do want to share one of the reasons I need a break is because the content, I'm so deeply emotional about the content that Shay and I have been talking about all weekend and all the last 3 months. And I need to release some emotion before I get into some other stuff. So I'm just going to share with you all that for at least 30 seconds of my 3-minute break, I'm going to shake my body very vigorously. And I'm sharing that in case you also need some kind of support like that.
Thanks.
So let's come back at 7:42. Thank you all.
Thanks, Emily.
Yeah, I'm so sorry I did not play the recording. So I'm going to just say that again, which is that we are talking about the Trends in Racial Disparities in Traffic Stops report from Stephanie Seguino at UVM. And this report shows that Black drivers are overstopped between 31 and 60%, overstopped compared to white drivers. That Black drivers are 4.8 times more likely to be arrested after stopped than white drivers, and that Black drivers are 9 times more likely to be searched than white drivers, and that when searched, Black drivers are 30% less likely to have contraband than white drivers are when searched. Okay, so
I would encourage Emily to put everything at the end and just share right now if it's acceptable.
Yes, I would like to. Thank you. So I just want to make it really clear at this point that we are going to be centering some of this data from the traffic stop study in our report. If y'all have a chance to review it, next week is a time we're going to be able to talk about recommendations based on that. Okay, so moving into some of the data from the department. I want to share the data that I have reviewed. And before I do that, I just want to say a thank you to we've had 3 members of the committee who have also been participating in gathering data and reviewing it and like looking at questions. And that's Kaz DeWolf, Bob Ozer, and Kelsey Rice. So thank you all for your time and effort that you've put into these reviews as well. It's been really helpful to have multiple eyes on different things. So I've reviewed all of the Brattleboro Police Department policies and procedures, all complaints and responses to those complaints in the last 2 years, all CPCC, Citizens Police Communications Committee notes, meeting minutes for the last 2 years, overtime usage from the department, response to bias motivation in incidents. This is a report that shows bias motivated incidents. So if an officer responds to an incident and the officer assesses that the incident itself was motivated by bias, this has nothing to do with an officer's bias. And in fact, the only mechanism right now that the department has to identify any bias if they wanted to in police officer responses is actually complaints from the community. There's no tracking or documentation of or observation or assessment. So supervision, right? Individual supervision or community citizen complaints are the only places where there's any data possible that are captured on police bias. And I'll use that opportunity to say that I believe there will be a fair amount of recommendations in our report based on missing data that's not being captured. For example, police bias. Use of force incidences in 2019 and 20, all use of force incidences is 2019 and 2020. I've reviewed all the data and I've reviewed a random sampling. That's the data I really most want to share with you today if I can. I've analyzed data based on incidences by offense types and drilled more deeply into suspicious activity, which is by far the most common offense type. The caller, right? The dispatch codes the call when it comes in, and then it gets recoded by the officer that responds. But the most common dispatch code, which is called a nature code, is suspicious activity. And that's 16% of all incidences that police respond to. And I have done, myself and Bob have done tracers, which is looking at all the documentation associated with a random sampling of cases. So my hope was to share with you today trends in my policy and procedures review, trends in the CPCC review. The biggest trend there is that the CPCC, self-admittedly, their focus is really on negotiation or mediation between individual complainants and the police. And so hoping to improve relations between individual people in our community who file a complaint and the police, and to help those two parties dialogue to see if there's any way to resolve, improve the citizens' comfort level or satisfaction with the police response to the complaint, that it's a very individualized focus, scope, and that they meet monthly for about 30 to 45 minutes. So they don't really have much more capacity in a lot of ways in their current structure to do much more. They do not identify that the CPCC is a place where any police accountability work is happening. So there's no review of trends. There's no review of complaints in any sort of aggregate way other than just the individual complaint. They invite the individual complainant sometimes, and they help mediate. So there's more to say about that, but that's like the biggest finding, I guess, around the CPCC is that they don't identify as an accountability committee. And so it's not a place that police accountability is happening at all, which they are aware of, and not something that they set out to do in their mission. So that means there's a huge gap in our town and in our community around accountability. I wanted to share more about trends in policies and procedures, but I will do that another time. I will share that I have a little chart that you'll see at some point soon, but the top 6 most common offenses or codes, which gives you a sense of what are the police responding to, right? Like in 2019, the police responded to 10,626 calls. In 2020, so far, year to date, which is 12/10 is the date, the police have responded to 7,874 calls. Okay, so of those calls, what are police responding to? So 15 to 16% over 2019, 2020 were suspicious person or suspicious circumstance. The next most common is 7%, 6 to 7%, which is animal problem. Well, I'm definitely going to learn more about that. I have no idea what that means.
Moose on the loose.
Moose on the loose. The next, third most common is at 5 to 6%, which is agency assist. an agency called the department and asked for assistance. The fourth most common is trespassing violation, which is about 5%. The fifth most common is welfare check, which is about 5 to 6%. And then the sixth most common is public speaking engagement, the 5 to 6%. And then there's a ton of other codes that make up the rest. But as you can see, the sixth most common is public speaking engagement, which makes up 5 to 6%, roughly. And that's the sixth most common. So all the other codes make up less than 6%, right, of calls. Right. So that suspicious activity, suspicious person is a pretty big chunk of the police response activity. And there's a lot of things that happen under that code. The arrest rate. So in 2019, 10,600 incidents, 752 of those ended up in arrest. That's about 7%. In 2020, it's 7.8%. The welfare check code. In 2019 and 2020, there was 968 welfare checks. 14 ended up in arrest. So that's 1.5% of welfare checks ended in arrest. Arrest being an enforcement action is just one indicator of effectiveness of use of police resources. Out of the suspicious person activity code, 6.5% end up in arrest. So the vast majority are not, don't end up in an arrest. And I have more data to analyze around the domestic violence circumstance code. It's a different code. It's not an offense code. Cases that end up being domestic violence cases get coded at a different point in the process. But the agency has an aggressive policing policy around domestic violence. Their specific policy essentially says that they will arrest somebody or work towards arresting somebody in domestic violence situations. Okay, I have very little time to show you the use of force data, which I'm not going to show it to you then, just because it would require too much.
I propose.
Yeah.
We have 2 meetings next week that we send you a when to meet about them. And that the first one, which is our regular meeting time, is finishing looking at the data. Emily and I will have way more polished. She'll start because I talk too much, and we'll show you the rest of the data. And then if that's okay, I see Lana says cliffhanger. I know it's tough. The second one would be the same agenda that we had planned for Monday, which would be, now you've seen the data in a fuller form, and then we can talk about recommendations. We really do want your support in thinking about recommendations. We have ideas. Our ideas are emerging as the data is becoming clearer about what people want and what people are experiencing and what harms are even happening and what just data analysis around that Emily's doing. But that's my proposal. Can I get a temperature reading from you all about how that sounds? Do people have availability for another meeting? I know it's a lot of meetings right now. We're all over Zoomed.
I think as we're wrapping up, it's important, and so what's one more meeting?
I don't want to make it so that you have less information than you deserve to support this process. Your role is in part to hold us accountable. And I want to make sure that we're being held accountable to that. And I want to give Emily more time to share because I just talked a lot. And I even felt bad because I didn't share with you any of the really emotional quotes that have been making me cry all weekend. So, so I think there's multiple uses of multiple meetings next week. This is sort of like the wham, bam, here's the beginning, but we're going to get deeper next week. Is that acceptable, Emily?
Yes, absolutely. Yeah. Yes, there's a part of me that just wants to give you like a couple of, I feel like I haven't given you enough, and I'm going to hold that. I'm just going to hold that concern. And just let you know that I have spent so much time in the last few weeks analyzing specifically the use of force data, that I think this committee needs to hear about, and we need to brainstorm ways to support our town and our community and accountability around use of force. There's no, it does not appear at this time that there's any system outside of the department itself that is reviewing or analyzing trends in use of force. And I will say one of the positive things about that is that we, in the last 2 years, this is not true of Brattleboro historically, in the last 2 years of 2019, 2020, a firearm has not been used towards a person. There's not been a use of firearm fired in a use of force. There have been firearms drawn regularly and other uses of force that
other uses of force.
Yeah, that need to be discussed. And again, there have been times in this town where firearms have been used, and there have been, there have been situations. So, but in the 2 years that we are reviewing, there are some trends in the use of force data that I think y'all really need to know about, and we need to talk about how to support the town in understanding accountability around that.
So as we close, we are gonna do more meeting next week because there's more to talk about. I would like to say that committee members, you are brilliant, and we're so grateful for the work that's been happening here together, and we've been working so much, Emily and I, on this project. And that I really look forward to our conversations next week, because I think that getting really visionary about how to support some of these harms and being reduced together, all of us, is going to be really crucial for this process. And we can't do that without the good information, which is why we're going to meet more, because you deserve more information to inform these ideas about change. And I also want to remind you all that our recommendations, as we proposed at the beginning, are for short-term immediate recommendations, mid-range, next year, whatever, 2-year, 5-year plan, and like long-term recommendations. And that can be budgetary, policy, structural, or like further study, further learning, further work. And please think about that as we move forward. You can't think about it fully until you have more information, and we can't have more information until we can share it with the public. And so it's, it's an emerging process, but we've been percolating ideas about what is possible a lot during this time, and just holding them in a holding space until we can figure out which of those actually meet the needs of our own community and what's being shared, particularly around the harms that some of these systems do. And I just want to encourage you, surround yourself with visioning and resources around harm reduction of all kinds this next week, because we're going to be discussing that next week.
I just want to say I shared the link to the Trends in Racial Disparities report in the chat, and the specific data that I shared is just on that front page of the executive summary, so you don't even have to get too deep into it to see that. Yeah, and as Shay said, we can't, we actually can't, I would love to send you all a bunch of information in between meetings, but we're actually not legally able to share information with you outside of public meeting system structure. So that is going to require more meeting time from us. So we will be in touch, and I deeply apologize to the public too that we didn't get more time in at the end here for y'all to share public comment, but we will get a another meeting on the books. We will be meeting next Monday, but we'll get another meeting in addition to that on the books and get it out to the public as soon as we can.
And our email is in the chat. Nope, that's wrong. Don't email that. It's actually at protonmail.com. Don't even listen to that. Our email is going to actually be in the chat now. Please send your comments there if you have them. We really have valued the public's support so far, and not support of our ideas, but support of the process, including criticality. Yeah. And Brattleboro.org, our community safety review committee general information, click agendas and minutes, click is where you find the links to our meetings. So please go there if you need to.
I just want to point out that next week is Christmas, right? Yeah. So we're going to be a little limited in scheduling. So anyway, I just want to put that out, and I, for one, am not available during the workday on the days that we are sort of in business in the world. So just hoping we can make it work in the evening on our limited options.
Yeah.
We'll send out a when to meet this evening, and then afterwards I'm watching The Crown. There. Said it. I'm not proud. I'm not proud. Okay. Adjournment?
Thank you
Acceptable?
all.
Bye, everyone. Thank you for
Thank you.